Doctors per person are less in India. If non-medicals also join us, they can at least help us in prevention.
Research shows that children learn more through the games than the textbooks.
I think hygiene, safety, whatever you can think of, you can totally convince the child to do that.
Welcome to the episode where we are exploring how to prepare and implement a plan to improve the health parameters. Health today is a massive problem area which we have so much possibilities to explore our volunteering opportunities in. Why? Because the amount of work that needs to be done is so much. The percentage of deaths that are happening because of lifestyle diseases has gone up to 70%. It means that there is a strong possibility you and I will be diagnosed with one eventually. People who are malnourished and also eating great food but the right kind of nutrition which has not gone inside the system have developed such random conditions in our bodies like our hair fall, skin dryness, our bodies getting dehydrated constantly, thyroid, sugar, blood pressure, possibly even cancer. And studies also suggest that a lot of mental health diseases that are kicking in is majorly because we are not healthy. Young girl children, their menses are kicking in at a very young age. It is time we paused and reflected about our life, about our lifestyle choices, about things that are happening around us and how it is directly affecting us. Now you might ask me this question, bro, why would I listen to you? It's not like you're a doctor, right? Well, let's hear it from a doctor.
Hello, I am Jyothi Lakshmi. I am MBBS doctor. I finished my medicine from Bangalore Medical College. Since 25 years, I've been practicing as a family physician. Apart from my profession, I have been a volunteer in many of the organizations like Youth for Seva. People who had lot of issues like comorbid conditions, we have all seen they have suffered a lot during COVID and we have lost many people during those 2 years of COVID. That is mainly because the lifestyle disorders which are already pre-existing and they were not diagnosed. Screening these lifestyle diseases are very, very important. Doctors per person are less in India. If non-medicals also join us, they can at least help us in prevention. So for prevention, we need to give awareness to people about the disease, how it comes, how you contact that, how to prevent such diseases. That can be done only by students.
ನಾನು ಹೇಳ್ಕೊಡ್ತೀನಿ ಕುತ್ಕೊಳ್ರಿ ಎಲ್ಲ. ಈಗ ಫಸ್ಟ್ ಸೋಪ್ ಅಥವಾ ಹ್ಯಾಂಡ್ ವಾಶ್ ತೊಗೊಂತೀರಲ್ವಾ, ಎಲ್ಲ ಕೇಳಿಸ್ಕೊಡ್ರು ಇಲ್ಲಿ. ಈಗ ನೀವು ಸೋಪ್ ಅಥವಾ ಹ್ಯಾಂಡ್ ವಾಶ್ ತೊಗೊಂತೀರಲ್ವಾ, ಫಸ್ಟ್ ಈ ಕೈಗೆ ಹಾಕೊಂತೀರಾ. ಈಗ ಫಸ್ಟ್ ಹಿಂಗೆ ಉಚ್ಕೊಬೇಕು. ಹೆಂಗೆ ಹೇಳಿ ತೋರಿಸಿ ಎಲ್ಲ ಒಂದು ಕಡೆಯಿಂದ ಹಿಂಗೆ ಉಚ್ಕೊಬೇಕು ಆಯ್ತಾ. ಆಮೇಲೆ ಹಿಂಗೆ ಫುಲ್ ಕಾರ್ನರ್ಸ್ ಎಲ್ಲ ಹೋಗ್ಬೇಕು ಈ ಕಡೆ ಹಿಂಗೆಲ್ಲ ಆಯ್ತಾ. ಇದು ಸ್ಟೆಪ್ 1 ಅನ್ಕೊಳ್ರಿ. We have been doing programs like AHAP, Adolescent Health Awareness Program, which is very important for the adolescents because during that age lot of changes happen physically, mentally, and as well as the society pressures will be there. The children will be more confused and they get lot of misinformation from all kinds of sources. So giving them the right information, which is the normal change that occurs during this age, and telling them how to deal with that will definitely help them.
ಅರ್ಲಿ ಅಡೋಲೆಸೆನ್ಸ್ ಅಂದರೆ 11 to 14 ಬರುತ್ತೆ, ಮತ್ತು ಮಿಡ್ ಅಡೋಲೆಸೆನ್ಸ್ ಅಂದರೆ 14 to 16 ಬರುತ್ತೆ, ಲೇಟ್ ಅಡೋಲೆಸೆನ್ಸ್ ಅಂದರೆ 18 to 20 ಬರುತ್ತೆ. ಅರ್ಥ ಆಯ್ತಾ?
The first step would be take training by experts. You can even do your own research or go to a nearby hospital, ask the experts their opinion about things like hygiene and nutrition things. But in spite of it, if you are not happy with the content and the source and you are not confident enough to go and take sessions on your own, you can always enroll with Youth for Seva, and Doctors for Seva has been doing this since 6 years. So we have got beautiful modules on which we have worked for years together and have come up with easy modules which you can understand and then definitely reciprocate.
ನೆಕ್ಸ್ಟು ಆಕರ್ಷಣೆ, ಪ್ರತಿಭಟನಾ ಮನೋಭಾವ. ಆಕರ್ಷಣೆ ಅಂದರೆ ಆಗಲೇ ಏನಂದೆ ನಾನು, ಅಟ್ರಾಕ್ಟಿವ್.
Step number 2 would be to identify the people who are already doing this work in your area, identify them and mirror them and take some training from them. Identify the school near your place, wherever you want to do. Take permissions before you start your classes and conduct the classes.
Till now, we have completed 13 schools by conducting AHP classes and wall corner paintings about 3 topics. One is menstrual hygiene and food hygiene and Madaka Vastuvina Durupayoga, substance abuse. ನಾವು ಇನೋವೇಟಿವ್ ಆಗಿ ಪೇಂಟ್ ಮಾಡ್ತೀವಿ ಎಲ್ಲ ಸ್ಕೂಲ್ಸಲ್ಲೂ. ನಾವು ಇನೋವೇಟಿವ್ ಆಗಿ ಪೇಂಟ್ ಮಾಡ್ತಾ ಹೋದರೆ ಮಕ್ಕಳು ಬಂದು ಏನೋ ಚೆನ್ನಾಗಿದೆಯಲ್ಲ ಅಂತ ಬಂದು ನೋಡ್ತಾರೆ, ಜೊತೆಗೆ ಅಲ್ಲಿರೋದನ್ನ ಓದ್ತಾರೆ, ಅವ್ರಿಗೆ ಅಟ್ರಾಕ್ಟ್ ಆಗುತ್ತೆ. ಅದು ಬಂದು ಓದಿದಾಗ ಅವ್ರಿಗೆ ಅಟ್ಲೀಸ್ಟ್ ಏನೋ ಒಂದು ತಿಳ್ಕೊತಾರೆ. ಅವ್ರು ತಿಳ್ಕೊಳ್ಳೋದಲ್ಲದೆ ನಾವು ಅಲ್ಲಿ ನಿಂತ್ಕೊಂಡು ಮೋಟಿವೇಟ್ ಮಾಡ್ತೀವಿ ಸ್ಟೂಡೆಂಟ್ಸ್ಗೆ. ಯಾವ ಥರ ಅಂದರೆ ಈಗ ನೋಡಿ, ಈಗ ಸಬ್ಸ್ಟೆನ್ಸ್ ಅಬ್ಯೂಸ್ ಅಂದರೆ ಮಾದಕ ವಸ್ತುವಿನ ದುರುಪಯೋಗ, ಅದು ಮಾಡೋದ್ರಿಂದ ನಿಮ್ಗೆ ಏನೇನು ತೊಂದರೆ ಆಗುತ್ತೆ ಅಂತ ಹೇಳ್ತೀವಿ. ಜೊತೆಗೆ ಫುಡ್ ಹೈಜೀನ್ ಅಂದರೆ ನಾವು ನ್ಯೂಟ್ರಿಷನ್ ಯಾವ ಥರ ತೊಗೋಬೇಕು, ಕಾರ್ಬೋಹೈಡ್ರೇಟ್ಸ್, ಪ್ರೋಟೀನ್ಸ್, ಲಿಪಿಡ್ಸ್, ಅದ್ರ ಬಗ್ಗೆ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡ್ತೀವಿ. ಜೊತೆಗೆ ಈಗ ಮೆನ್ಸ್ಟ್ರಲ್ ಹೈಜೀನ್ ಬಂತು ಅಂದರೆ ನಮ್ಮ ಗರ್ಲ್ಸ್ ವಾಲಂಟಿಯರ್ಸ್ ಇರ್ತಾರೆ. ಜೊತೆಗೆ ಈಗ ಬಾಯ್ಸ್ ನಾವೇ ಹೇಳ್ತೀವಿ ಅಂದರೆ ಗರ್ಲ್ಸ್ ಎಲ್ಲ ಸಂಕೋಚ ಪಡ್ಕೋತಾರೆ. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ನಮ್ಮ ಜೊತೆ ಗರ್ಲ್ಸ್ ವಾಲಂಟಿಯರ್ಸ್ ಇರ್ತಾರೆ, ಅವರು ಮಕ್ಕಳಿಗೆ ಈಗ ಮೆನ್ಸ್ಟ್ರಲ್ ಹೈಜೀನ್ ಬಗ್ಗೆ ಹೇಳ್ಕೊಡ್ತಾರೆ.
You can start as a simple way, other than adolescent health awareness program. You can start as a health awareness program, which basically you can teach the basic personal hygiene as well as environmental hygiene for the kids.
Hand wash, dance ಮಾಡ್ಕೊಂಡು ಇನ್ಮೇಲೆ hand wash ಮಾಡಿ, ಓಕೆನಾ? Wash your hands, wash your hands, wash your hands. Grab some soap, grab some soap, you do. Grab some soap, you do.
And healthy relationships also can be taught by you, because you're all youngsters, you're just passed through that age. Not getting carried away by the peer pressures or the pressures that occur around you. People asking you, bullying you, or forcing you to get into bad habits like smoking, drugs, addictions, things like that.
ಸಿಗರೇಟ್ ಅನ್ನು ಕುಡಿಬೇಡ್ರಿ, ಆರೋಗ್ಯಕ್ಕೆ ಒಳ್ಳೆಯದಲ್ಲ. ಡ್ರಿಂಕು ಸಿಗರೇಟ್ ಏನು ಕುಡಿಯಕ್ಕೆ ಹೋಗ್ಬೇಡ್ರಿ. ನಿಮ್ಮಿಂದ ಇನ್ನೊಬ್ರ ಲೈಫ್ ಕೂಡ ಹಾಳಾಗ್ತೈತೆ. ಧನ್ಯವಾದಗಳು.
Health and hygiene, nutrition, substance abuse, these are simple topics which you can start adding value in lives of children. Now you might have this question, sir, this is not simple topics, sir. Honestly, relationship, substance abuse, these are topics even we are struggling with. How do we add value in children's lives with these topics? I'm a little bit scared. Well, if you're someone who's saying, sir, we just want to go and chill, have some fun with children, here is Sachin with his framework of Inspire Minds, where he is creating change with games.
This is Sachin Revantkar, founder of Inspire Minds. We use the power of games and stories to reach the hearts of the children with the lessons of health and nutrition. Take a moment to observe these children. They are filled with so much of energy and a curiosity to learn. Yet, the food they eat doesn't have enough nutrition. It is crucial for us to instill right eating habits in children early on, ensuring a future free from diseases. Research shows that children learn more through the games than the textbooks. This is a Nutrition Smart, a card game for children aged 9 years and above. And it has 3 packs of cards. One is the macro pack, mineral pack, and then the vitamin pack. So each pack has 45 cards, 5 quiz cards, and then 40 food cards. Food cards cover various information about various carbohydrates, proteins, fats, and fibers. All this data is from National Institute of Nutrition, which is a government organization. We can play the game in 5 different ways. I'll explain one of the way to play the game. Let's pick one of the nutrient which we want to learn today. So assume you want to learn about protein-rich foods. So let's pick up protein quiz card. And now the goal of the game is to accumulate foods which are rich in protein. How? I'll explain. So here we equally distribute all the cards among all the players. Each player gets fixed set of cards, and then they have to place it without shuffling it. Now the first player will drop the top card, and when they are dropping it, they'll say the protein content in that food. So in this case it is ghee. Ghee has 0.3 grams of protein. So every player will drop their top card. The player who has highest protein in that card set gets all the cards and keeps it at the bottom of the pack. So this will continue for a couple of rounds. When any player is out of the card, he is out of the game, and any player who gets all the cards wins the game. Let's see how we can clear some misconception about nutrition while playing the game. What comes to your mind when I ask you about calcium-rich food? Normally, the answer is milk. Milk has only 121 milligrams of calcium. Other food that comes to mind is banana. Banana has only 5 milligrams of calcium. Beyond this, people fail to answer. Next, very good calcium-rich food is ragi. Ragi has 364 milligrams of calcium, 3 to 4 times more than milk. And one more surprising food item which has huge amount of calcium is sesame seeds. It has 10 times more calcium than milk. So this is what you learn while playing the game. Here is a 3-step framework to design your own game on various social causes. Step 1. Define your outcomes before designing the game. Be clear with what should be the learning objectives. This will help you to design a good and engaging game. Sit with your team and brainstorm various game ideas. Explore various board games, card games and various activity-based games. And then finalize one of the idea. Step 2 is game development. You have to design a game in such a way that it is very easy for children to learn. Too much of information, it's confusing for the children. Keep it simple. The more the time in learning, the children lose interest. Collaborate with various local designers, artists and various craftsmen and bring this game into life. Step 3. Test your game. Sit with small number of children, play with them, observe how they are playing and listen to their feedback. Incorporate their feedback into the game, improve the game. I invite you to join this playful and transformative journey. Let's play together and rewrite India's health story.
Well, if you are someone who is an artist, can you use that not just to entertain, but to facilitate change? Here is a change maker who's been creating massive impact using performing arts as a tool.
My name is Harish Bhuvan. I have been a therapeutic clown for close to 10 to 12 years. And what it entails is that we dress up like clowns, we go to hospital, make children happy there. The hospitals were like, we can't give permission to individuals. And that's when we went there and registered our organization as a trust. We've had more than 5,000 volunteers who have volunteered with us. Okay, clowning is simple. Everybody clowns on a day-to-day basis, but when you label it, people become more than conscious. If you see backbenchers, what are they? Right? I was a backbencher. We clowned. We clown with our friends, we talk to teachers, we give back answers, we give answers that we think are funny, and in turn the entire class starts laughing. Clowning simply means taking other person's need into priority and doing what they want, in turn making them happy. It's as simple as that. But when it is clowning, you do it with the help of some props, some makeup, and a little bit more open-mindedness. For children who have loss of appetite in hospital, I've created a song known as Banana Song. So when we are doing Banana Song, you know what parents do? Parents come, take a banana and enact the entire banana song. What ends up happening is that child eats the banana and child is having a lot of fun. So if small things like making the child eat banana also can be conveyed through clowning, I think hygiene, safety, whatever you can think of, you can totally convince the child to do that. Clowning, like I said, happens in day-to-day life. But if you want to do it in an organization, in a hospital, there are certain steps. Step 1, wanting to clown. Wanting to make people happy is getting into the mindset of clown. Step 2, you can go find out places where you can clown. It is not required that you do it in a medical center only. You could do it in government schools, you could do it in help centers, you could also do it in a railway station, you could do it in a metro. Very, very important part. As you remember, I might have said, the organizations, when they say you are an independent individual, how will we give you permission, is when you incorporate your educational institutions. You get a letter from your educational institution that you are studying in so-and-so degree, in so-and-so class, your registration number is so-and-so. With that letter, you go to whichever organization that you want to do volunteering activity. You show that to the organization. Of course, there will be a couple of meetings here and there. But once you get the permission, you could fix up a day. Every Saturday evenings I will come. Every Sunday mornings I will come. But keep very, very important thing in mind that these children start looking forward to meeting you. If you are establishing that connection that you will come every Sunday, every Saturday at so and so time, make sure you show up. It's all about consistency. Otherwise, you'll end up breaking their expectation. Then they start thinking that, oh yeah, this is another guy, this is another crowd, this is another group who've come. Step 3, go there. If there are children around, get down to their level, maintain eye contact. If you are talking to a child who is just 3 foot 7 inch and you are 5'9", if you are talking while standing up with this child, what the child feels is intimidation. So as a clown, you need to go on your knees. You need to come eye to eye with the child. And when you talk like that with them, they feel relatability. They feel this is somebody whom I can trust. And start with simple question, what is your name? You can't just say, hey, oh. Start with asking names. That's how you enter their trust zone. Step 4 would be to start asking what do they enjoy doing in. Step 5, do that with them. Child safety is also an increasing concern in the society today. What you can do is when you are clowning with children, when you are talking to them, I'm sure you would want to go closer. When you want to go closer, what they might perceive you as is a danger also. So it is your responsibility to maintain that safe distance. Each child will receive you differently. It is not a reflection on your work, how you've done it, but it is the child's reflection of how you are being perceived by them. Gauging how a child is looking at you, whether the child is looking at you with a lot of trust or whether the child is looking at you with suspicion. If there is suspicion, there is sadness, if there is anger, frustration, for n number of reasons, not because you are coming and approaching them, for n number of reasons, it is better to take a step back. And last but not the least, when you are going to clown there, they want to spend time with you. Don't use your phones.
Thank you so much for joining us in this episode. Do check out the other episodes as well, where we have explored more change makers, more problems which are solved in innovative ways. Do write to us if you have any queries at all, and do check out the resources which are attached in the description for your ease in conducting Seva.